We're really excited to welcome you to this session of COVID-19 vaccination, building global capacity. It's the first session in our health worker series. The title of today's session is Interpersonal Communications for COVID-19 Vaccination. Next slide, please. I'm just going to run through a few housekeeping items. Most importantly, we have interpretation today in French, Spanish, and we're still working on Arabic, but should have it hopefully momentarily. And you just go down to the globe icon that says interpretation at the bottom right of your Zoom toolbar and click on the language that you would like to be listening to. Next slide. We really look forward to your questions and comments. There's a Q&A feature at the bottom of the Zoom toolbar. Please put your questions and comments there. We hope to get to as many as we're able to. If you have any IT or logistic or issues related to certificate of attendance, please mention that in the chat. We'll be monitoring both Q&A and chat. Next, please. Just a note that today's session is being recorded and your attendance is consent to be recorded. We will be recording in all three languages, or actually all four: English, Arabic, French, and Spanish. And we'll be sharing those through a link to a website set up for this series toward the end of the session. We hope to have the recordings up within a day or two. Also, there will be a certificate of attendance, and we'll put a note in the chat, a link to a quick survey. And we really look forward to your feedback about how these sessions are supporting you. That will be near the end of today's session. Next slide. Very quick note about data use. The data you share with us when you register in the polls, et cetera, is all kept confidential. And we just want to ensure you that data stewardship is something we take very seriously. Next slide. Just to note that this series is being built off two open WHO trainings. One focused on training health workers, which today's series is related to. Another that is related to national deployment and vaccination planning. And we encourage everyone to consider taking those online courses, and we'll share the links to those in the chat. With that, Shoshana, I'll hand it back to you to introduce our first speaker.
Wonderful. Thank you so much, Bruce. Next slide, please. Great. So we'll turn first to Michelle. Michelle will give us an introduction to all of the different speakers today, and we'll talk through the goals and learning objectives. Over to you, Michelle.
Thanks, Shoshana. Welcome and thank you to everyone for joining us. I'm going to provide a brief introduction of speakers, and then we'll review the goals and objectives for today's session. Next slide. First, let me introduce myself. My name is Michelle Dines, and I am an immunization demand specialist with the UNICEF East Asia and Pacific Regional Office. Both as a nurse and as a midwife, I'm especially pleased to be here to talk with fellow health workers and public health professionals. Now I'd like to introduce Kate Bagshaw. She is a technical officer in the Immunization Center with JSI, or John Snow. Next, let me introduce Melinda Frost. She's a technical officer for infodemics management with the WHO, risk communication and community engagement team. And then finally, it's a pleasure to introduce Shoshana Golden. She's a technical officer with WHO's country readiness and delivery workstream. Okay, next slide. So the goal of this session is to improve the capacity of health workers to communicate about COVID-19 vaccination in order to foster trust and enhance vaccine uptake. By the end of the session, we hope that you will be able to define the concepts of immunization demand and hesitancy, identify strategies for communicating with community members in order to manage misinformation and increase acceptance. And third, to describe effective communication messages, common communication pitfalls, and how to improve the service experience for community members. So we're now going to launch an introductory poll. So hopefully you will see that soon and we'll be able to answer. Next slide. So our agenda for today's session will begin with some announcements, followed by content on demand for COVID-19 vaccine, managing misinformation, effective communication, and then we will review what will be coming up next in the series, and we'll have about 20 minutes for questions and answers at the end. I will now transition back to Shoshana, who will provide some announcements and share the results of the poll.
Wonderful. Thank you so much, Michelle. Next slide, please. Next slide, please. A couple of announcements for everyone today on this call. The first is that you can find all of the COVID-19 vaccine introduction resources on the Country Readiness and Delivery website. This is currently in the process of being restructured to make it even easier to find all of the guidance, tools, and trainings you need to prepare for and actually implement COVID-19 vaccination. Please feel free to send any questions, comments, or feedback to the COVID-19 vaccine resources at who.int help desk. Next slide, please. I'd like to announce the launch of several new resources that may be useful for you in your work. The first is the COVID-19 vaccine supply and logistics guidance. This document provides information about how to prepare for and actually conduct supply chain and logistics for all COVID-19 vaccines. It's a really helpful, useful resource. And it's available on the Country Readiness and Delivery webpage and will be shared through the chat as well. The second resource package is on acceptance and demand. Within this package, there is guidance, tools, and templates to help with COVID-19 vaccination acceptance and uptake, to support community engagement, and to help you with misinformation management. Some of these topics we'll be covering today during our session, but these resources will provide you additional context, information, and tools as you move forward. Next slide, please. Can we now please share back the results from the introductory poll? Okay. Next slide, please. I'll turn over to Michelle and Kate, who will talk to us about how you can help increase acceptance and demand for COVID-19 vaccines.
Thanks, Shoshana. So next slide, please. There's been a lot of discussion over the past few years about the concept of vaccine hesitancy. You might have even heard that it was named by the WHO as one of the top threats to global health in 2019. So let's start with the definition. Vaccine hesitancy is the delay in acceptance or refusal of vaccines despite those vaccine services being available. It's important to understand that hesitancy is just one aspect along a spectrum of intention to immunize. Here on this slide, we focus on one's intention to receive the COVID-19 vaccine. The spectrum of intention goes between two extremes. On the left side, you find activists who are actively trying to get others to reject vaccines, all the way to the right side of the graph, where advocates actively try to get others to accept the vaccine. The reality, though, is that the majority of people fall between the two extremes, with most people accepting vaccines. Immunization demand is defined as the actions of individuals and communities to seek, support, and or advocate for vaccines and immunization services. As people move along to the right side of the graph, their level of demand, or in other words, their intention to be vaccinated, increases. And what's really important for you to understand is that your communication strategy with community members and clients in interpersonal interactions about COVID-19 vaccination should and will depend on where people fall on this spectrum. Next slide. So this flow diagram was developed as a job aid to help health workers communicate during a vaccine session. It breaks down the session into 6 basic communication steps, and I'm going to describe that now. In step 1, You want to determine eligibility for COVID-19 vaccines and to make sure you can rule out any contraindications that the community member might have. Now, if they're found to be eligible and they have no contraindications, you would move on to step 2, where you make what we call a statement of presumption. And let me explain that a little bit more. This statement usually includes a positive message that they are eligible for the vaccine and that you will prepare it. This should be said with enough enthusiasm to show your excitement that they are eligible. Health workers are some of the most trusted professionals, and so your reaction and the way you talk about COVID-19 vaccines really matters. We found that presuming acceptance of vaccination at this stage in the discussion is a preferred approach. If you ask about their level of interest in COVID vaccine before you've shared key messages, it could cause some unnecessary doubts. So using a statement presuming acceptance can also help to normalize receiving the COVID-19 vaccine, just as you might feel when offering routine child immunizations. So step 3 is that opportunity to share key messages. And usually we want to focus here on the benefits of vaccination, the common side effects, and how to handle side effects, and then any potential risks. Once you've shared key messages, you can move right on to step 4, where you have an open discussion about any questions or concerns they might have. We cannot emphasize enough how important it is to make the community member feel comfortable so that they feel they can ask questions and share their concerns. And then your response with empathy makes a big difference. This helps to build trust and helps to ultimately increase vaccine acceptance. Once you've addressed the questions and concerns, you can move on to step 5, which is the process of requesting consent to vaccinate. It's important to remember that not everyone will consent to COVID-19 vaccines. Your role is to remain respectful no matter what their decision is. Leaving the health facility with a positive experience, whether they've gotten vaccinated or not, will help increase the chance that they will return for services and probably even increase the chance they might change their mind about the COVID-19 vaccine. And then finally, in step 6, you'll either vaccinate if you were able to obtain consent, or you'll provide information for them to take home if consent was not obtained. This step also includes some important take-home messages about continuing COVID-19 precautions, when they should return for a follow-up visit, and helping to encourage them to let other priority group members know that they should come and be vaccinated. Next slide. So my colleague Kate Bagshaw and I are going to demonstrate how you might communicate with a community member who has questions and concerns about COVID-19 vaccines. I want you to really listen for the communication steps that we just reviewed, including specific techniques such as giving a respectful greeting at the beginning, presuming acceptance and the language of how to do that, responding to concerns with empathy, and what to say after someone has received the vaccine. Next slide. So in this role play, I will be playing the midwife and Kate will be playing our community member. Good morning, Ms. Bagshaw. My name is Michelle and I'm the midwife here at the health center. It is really nice to see you today.
Hi, Michelle. Nice to meet you. You can call me Kate.
Thanks, Kate. So I have reviewed your chart and I've noted that you have not been vaccinated for COVID-19 before. Is this correct?
Yes, that's right.
Since you have high blood pressure and you're not currently pregnant or breastfeeding, you're eligible for the COVID-19 vaccine, so I can prepare it for you.
Oh, okay.
First, I'd like to tell you some important information about COVID-19 vaccines. It's very effective at preventing you from getting COVID-19 infection and from keeping you from getting seriously ill if you do get the virus. Because no vaccine is 100% effective, though, it's important that you continue to take precautions after you've been vaccinated. There are some common side effects from the vaccine that can last up to a couple days. For example, it's common to have pain or redness at the site where you receive the vaccine. You can use a cold compress to help reduce the pain or any swelling.
Okay, that's good to know.
Some people will feel more tired than usual or could develop a headache, fever, or chills. You can take paracetamol to help you feel better if you experience that. These symptoms can be a sign that your immune system is responding to the vaccine. But don't worry if you don't experience any of these. It doesn't mean that the vaccine isn't working. Now, a small number of people may have a severe reaction that requires immediate attention. Now, this is very unlikely, but if that should happen, you should come to the health center or the hospital right away. Do you have any questions I can answer?
Well, I think vaccination is a good thing, but I have been wondering about something.
Okay, what can I help you with?
I'm really afraid of getting COVID-19. I have a good friend who is my age who got the infection last month and almost died. What will happen if I get COVID-19 vaccine? It's really stressing me out.
Kate, first, I want to say how sorry I am to hear that your friend was so sick. That must have been really scary for you and her family. Now, you have a really excellent question, and I'm happy that you shared it with me. The vaccine is not made with the live virus that causes COVID-19, and that means that you cannot get COVID-19 from the vaccine. So you're not in any way putting yourself at risk for developing COVID-19 infection. Does that make sense?
I had no idea. Yes, that makes sense. This is such a relief.
Okay, great. Now, are there any other questions or concerns that you have?
No, that was the only thing I was worried about.
All right, great. So Kate, since we've discussed all of this and we've reviewed some of that important information, do I have your permission to give you the COVID-19 vaccine now?
Yeah, I'm actually really relieved to get it.
Wonderful. Okay, there you go, Kate. Now that you've been vaccinated, I'd like you to stay here at the health facility for 15 minutes to make sure that we can monitor you for any reactions. And after that, we would like to have you return in about 4 weeks for your second vaccine. And this is really important to make sure that the vaccine is as effective as it possibly can be.
Okay, I'll be sure to come back for the second dose.
Great. Also, I want to encourage you to let anyone you know who's part of a priority group to come for vaccination. We want to protect as many people as possible.
You know, I'll talk to my neighbor. He is older and can't drive. Maybe I can give him a ride.
That's a great idea. And before we finish, I want to remind you to continue using precautions such as wearing a mask, social distancing, and good hand washing.
Yes, I will. Thank you.
It was such a pleasure meeting you, Kate. Have a lovely day, and I will see you in about 4 weeks. And next slide.
Thanks, Michelle. So for the next session of the webinar, I'm going to be talking a little bit about misinformation management and how you can take some lessons learned from sort of more community-based or nationally based communication and apply it to the shot giving scenario when it comes to misinformation. Next slide, please. So it's important to know that misinformation or rumors don't all fall into just one category. We've been able to divide these out and according to sort of 3 different groups of misinformation or rumors. The first is actually when we talk about misinformation, it can include sort of accidental falsehoods. This means it could be just outdated information or it's just slightly misinterpreted and shared on. It doesn't necessarily mean that bit of information has a negative intent, whereas disinformation is actually deliberate and engineered falsehood, which circulates maliciously. And this can be some of the information that we often see coming from the anti-vaccine groups. And then there's rumors, which is just basically unverified information or stories or report that are usually quite engaging and therefore spread really rapidly. It's important to know that rumors aren't necessarily always false. They can be true rumors. So a lot of our recommendations when it comes to this, particularly around vaccines, you can see some of these things in the past, is to try to sort of debunk myths and rumors and try to do this ahead of time, so to pre-bunk these things. And you can do this more at a community level where you have the time, particularly now maybe in the planning process, to do what's called social inoculation. And that helps prepare people that there could be misinformation coming around a certain health topic. So it's important to tell sort of maybe more at a community level that they're likely to encounter some misinformation, and these may be coming through social media channels. This sort of alerts people that some information they may be receiving and reading may not be true. So it's important for them to kind of really deduce what they're reading and how to then decipher what might be true and what might not be true, and to where to find some solid health information. So it's theorized and it's proven true that sometimes this makes it less likely for people to then believe it and then share on this bit of misinformation. And so it's important because we're sort of building a resistance in our population to misinformation. It's more important, and we've seen it more than ever now in COVID-19 response. So next slide, please. So we have a formula that can be used, again, more at a community level of communication, but can be used when you have this sort of more nurse-patient relationship, and when you may be getting individual questions from those who are about to receive the vaccine. And you can use this formula when you communicate with individuals that may be concerned and may be presenting some misinformation or misunderstandings about misinformation around the vaccine. And the formula basically says that, you know, you lead with the factual information. So when you hear a patient and they may be sharing something they've heard and it's not true, it's important to kind of feedback, you know, in a very respectful manner, and start with the facts, start with the truth, and then warn them in a delicate way that maybe what they've heard is some misinformation and it may be coming from a unreputable source, and not to repeat the misinformation too much. You can touch on it, but don't heavily repeat the misinformation, because that may be the thing that will stick in that individual's mind. Then it's important to explain the fallacy behind that bit of misinformation, explain why that isn't true, and then provide some factual information. And then finally, sorry, the questions can repeat the fact at the very end again. So those are the things that will stick in the individual's mind, what they hear first and what they hear at the end. And it's also important to know that misinformation comes in different forms and may be a couple different sources. It may be that individuals have heard this from sort of fake experts or people who are presenting themselves as experts in the area, but may not have a huge depth of knowledge around vaccines. It could also be sort of logical fallacies. And in many cases, we see this coming from sort of imbalanced news reporting, where maybe only one side of the story is presented, or in an attempt to bring in both sides of the story, the vaccine story, something with little evidence is given equal play to all of the wealth of evidence that we have around vaccines. Also, the idea of implausible or impossible expectations. So some of the communications we use around uncertainties can be brought forward as science doesn't know, and therefore this must be bad. Cherry picking facts, taking small stories or case studies that aren't broadly applicable and using those in very compelling stories. And then of course, sort of broader conspiracy theories are things that kind of play into individuals' misunderstanding or absorption of misinformation and disinformation. Next slide, please. So if we kind of go through the scenario that was just outlined by Michelle, we go down through the communication that can happen during a vaccine session. We're going to focus this next role play on how to handle misinformation and how to also address the issue if consent is not given for the vaccine. So with this, I'm going to do a short role play with Kate, and we can go to the next slide. And I'm going to play the part of the vaccinator, and Kate will play the part of my patient. So good morning, my name is Melinda. Welcome to our Community Health Center. I understand that you've been registered to receive the COVID-19 vaccine as part of our priority group because you're a health worker. Congratulations.
Hi, Melinda. It's nice to meet you. You can call me Beatrice. However, I'm not so sure congratulations are in order. I'm hearing some not very positive information about this vaccine, and I'm concerned.
Let's take a minute to talk about that. Tell me what information you're hearing, and just as important, where are you hearing this information from?
Well, there are a number of things. I listen to a popular radio show called True Talk. They often interview a local chiropractor, Dr. Tran, and he shares his opinion on different health matters. Even he questions the safety of the vaccine because of the speed at which it was developed. I'm an educated health worker, but I must admit, I have a hard time accepting the vaccine if physicians are doubting the safety.
Oh, okay. Thank you for sharing this with me. I can understand your concern, and you're absolutely right. The COVID-19 vaccine was developed quickly. However, it's important to know that the COVID-19 vaccine development process, including safety and efficacy testing, was the same as with all vaccines. The vaccine trials just proceeded faster than was possible with other vaccines because of the high risk from COVID-19. It was so severe that tens of thousands of people signed up rapidly to participate in the vaccine trials. Typically for other vaccines, it can take over a year or 18 months or more to recruit even just a fraction of the number of volunteers we've had for the COVID-19 vaccine. So the vaccine development and trial process was done with just as much scientific scrutiny as with other vaccines.
But Dr. Tran didn't mention any of this on his radio show.
Yeah, that's troubling, but it's not surprising. Unfortunately, it sounds as though the doctor was giving his own opinion, and perhaps the radio program didn't seek an opposing point of view. The opposing view would have probably provided details about how the COVID-19 vaccine development process followed the same processes for safety and efficacy testing that we typically use for other vaccines.
Okay, I guess I understand, but what about some of the new technology they've used to develop the vaccine, particularly the mRNA vaccine? Do we know enough about that? My husband and I want to have children someday. What if this vaccine affects my future babies or my ability to have babies at all?
Okay, Beatrice, these are really good questions. The mRNA vaccines are synthetic and do not contain a weakened form of the actual virus like some vaccines that we're used to. Instead, this vaccine generates a protein that safely prompts our immune system. It's as though the mRNA vaccine delivers instructions that allow our bodies to make a protective response. Some experts say that this is just as unlikely to change your genome as eating fish will make you grow gills.
I don't know. It still feels too soon. There's too little known and too much personally writing on this decision. I'm just not sure.
Yeah, Beatrice, I know it's a lot to absorb. And I also know as a healthcare worker that we're under a lot of stress. But there's a reason you're considered priority for this vaccine. You're at higher risk to contract COVID-19 because of your work setting. There's also a lot of trusted information resources that describe the vaccine development process and other safety data. I'd encourage you maybe to look at the WHO website, World Health Organization, at who.int, or our National Public Health website, moh.gov. These both provide up-to-date information about the COVID-19 vaccine. So Beatrice, what do you think now? Do I have your permission to give you the COVID-19 vaccine?
Thanks for the information, Melinda. I think I need to spend some more time reading about it before I can make a final decision. I just don't think I can get the shot today.
It's okay, Beatrice. I really do appreciate your time today. Why don't I send you home with a few pamphlets that may answer some more questions that you have. Don't forget to keep up your protective measures of wearing a mask, washing hands, physically distancing, and opening windows. I know you know all of this because you're a health worker. It was really a pleasure to meet you, and please don't hesitate to call me or the clinic with any additional questions. If you change your mind, we'll be here to help you.
Thank you. Next slide. Now we'll spend some time talking about effective communication messages, communication pitfalls, and service experience. Next slide, please. On this slide, we share with you 5 common pitfalls to avoid when providing messages to community members. The first pitfall is mixed messages. Mixed messages can cause confusion and mistrust. It is important to reflect a single message with community members. In order to do this, discuss among your colleagues to agree on key messages and be consistent when giving them to the community. The second pitfall is speaking with a paternalistic or condescending attitude. An example of this would be, I'm a highly trained professional. I know what I'm talking about. It is important to speak to the community member as an equal and to acknowledge their perspective. An alternative statement could be, I value your perspective. I have additional information that might be useful. A third pitfall is over-reassurance. Over-reassurance can sound like, there's no need to worry. The vaccine is 100% safe. It is better to be transparent with community members than to say something that we are not sure of. A transparent message could be, we are still learning about the safety of the vaccine for children and pregnant women. A fourth pitfall is the use of jargon or medical terms. Talking above the client's level of understanding can make them feel uncomfortable and prevent them from asking questions. Try to match the message with the listener. Provide clear information at the right level to encourage interaction and discussion. This will make you more accessible to the community. The fifth pitfall is being dismissive of concerns. Rather than saying, trust me, side effects are minimal, it is important to acknowledge concerns with empathy. Try saying something like, thank you for sharing your concern. It is possible you may experience some side effects. Severe reactions are rare, but if you have one, please go to the health center or hospital right away. This shows the community member that you are listening, you value their perspective, and have more information available to help address their concerns. As you can see, in addition to knowing the facts about COVID-19 vaccine and vaccination, it is also important to be aware of how you are communicating messages to community members. Reflecting a single message, speaking to the community as an equal, being transparent with information, limiting the use of medical jargon, and acknowledging concerns with empathy can support a positive interaction for both the health worker and community member. Next slide, please. In addition to using effective communication approaches, there are other ways to make the immunization experience better for community members. If you look on the left-hand side of the screen, there's a diagram. The first that we'll talk about is partnering and engaging with the community to meet their vaccination needs. Some ways you can do this include considering flexible hours, days, and locations to increase access to services for your community members. Learning about the priority groups for COVID-19 vaccine that are lesser known to you. In some situations, you may not have experience vaccinating adults, so getting to know what their questions and concerns are will help you to better communicate with them. And talking to local leaders about supporting COVID-19 vaccine. whether that be helping to identify members of priority groups and encouraging them to vaccinate, or working with you to understand how to respect priority groups. The second is creating a positive and calm environment for when the time comes to vaccinate. This can include ensuring that the space, whether it's a health facility or an outreach site, is clean, organized, and follows COVID-19 precaution protocols. Providing privacy for the community member, if possible. Welcoming the community member warmly, and then showing sensitivity if PPE causes alarm. Some community members may not be used to seeing you dressed in PPE, so showing empathy and explaining the purpose of the PPE is important. The third is about communication and reiterates many of the points we have discussed earlier in the session. Make sure to use simple and respectful language. Share key messages about the COVID-19 vaccine, explain how to deal with common side effects, and use SMS, email, phone, and community mobilizers to follow up after vaccination. The final point highlights what can be done during vaccination itself. When vaccinating, the following are useful guidelines: using neutral language to reduce anxiety, no aspiration during injection of the vaccine, and positioning adults appropriately. Adults should sit up unless they have a history of fainting, in which case they should lie down. Thank you for joining us. I will now transition to Shoshana, who will walk us through what's next, including feedback, some time for question and answers. Shoshana?
Thank you so much. Next slide, please. We will now launch the feedback poll. So I ask the Echo India team to please launch the feedback poll. Next slide, please. The presentation and the recordings will be shared with all participants through your email, which we have already, no need to reshare, after this session. So you can look to that. They will also be included on the webpage where all of the Project Echo presentations and sessions are being captured. To continue this conversation and ask your questions even beyond this hour-long session, you can post your questions, offer insight, and share your experiences on TechNet and on Telegram. You can see the links here in the slides, and they will be shared in the chat. Next slide, please.
Shoshana, this is the end of the slides for me.
Okay, so there is now the opportunity for folks to ask questions through the Q&A portion. While you do that, I will share a little bit of information about the next couple of sessions. Our next session is intended for our national and subnational focal points. It'll be next Tuesday on 12 to 1 p.m., so same time, and we'll focus on indemnification and liability. On the 2nd of March, we'll have a session again for health workers. For this group again, focus on infection prevention and control for COVID-19 vaccination. At this point, we welcome your questions, and we'll turn back over to our panelists so we can start answering the first couple questions that have come in. So I'll turn to Kate, Michelle, and Melinda. We have a question from Loam Lien, who asks what she can do as a community pharmacist to help with acceptance and demand for COVID-19 vaccination.
Hi, Shoshana, I can answer that. So I would just recommend that as a pharmacist, that you are making yourself available to people to answer their questions. We can build trust with community by allowing really transparent communication. I know someone had also asked about how do you deal with communicating about side effects. And I think the best way to do that is to be completely transparent. The more information people have, the less likely they are to be concerned if one of those side effects happens to them. And so make people understand that you're available to answer questions and to address concerns. and be transparent in your communication so that they know what to expect and they're less likely to be concerned if they have one of those side effects that you've mentioned. And then one of those misinformation techniques that was suggested by Melinda, was that you can preemptively give people information to what she called pre-bunk the myth. So if you hear there are some rumors out there in the community, you can mention to people, by the way, there are some rumors about this, but I want you to know what the reality is, and I can give you some better explanation for the science behind that and why that isn't true. And that can help make people less likely to share a myth or a rumor that's wrong and less likely to believe it themselves. So I would say keep the communication lines open with the community and make sure that they know you can be a source of information. Thank you.
Wonderful. Our next question is from Carla Toko, who asks, what is the best way to respond to misinformation and disinformation on social media?
I think I can jump in on that one. I think the best way to respond is to, again, kind of use that formula that I provided, provide the factual information. And the other thing that we really try to do, at least at WHO, is to get other reputable sources to also share that information. As an individual, it's good to sort of quote other trusted organizations, probably your national
mistake in trying to respond to misinformation is to share that same information that was wrong. And so I would strongly suggest, if you are trying to help debunk misinformation, that you don't actually share whatever that message is or share that post. Instead, you can counter information by adding a post that has the correct information, and that will help to counteract that information from the post that was sharing misinformation.
Wonderful, thank you. Our next question from Timidayo, apologies if I am mispronouncing your name, is how can we deal with the fact that COVID-19 vaccines may be causing vaccine hesitancy that's impacting routine immunization? I'll turn over to Kate, Michelle, and Minji to provide some insight.
So this is a common issue we've seen with other vaccine introductions, especially in countries where there was a adverse event following immunization that people attributed to immunizations in general, and therefore it had the reaction of not seeking out even the routine immunizations that usually happen. So what I would say is we can do something called social listening, trying to keep up with what the rumors, the myths, and misinformation is, so that we can be responsive to that as early as possible. I think that's really helpful. We do some webinars on crisis communication, and there's ways of responding to adverse events after vaccination that can help the community to remain calm and to have a better understanding of the situation. And some of those suggestions are just being transparent, always provide updated information on a regular and scheduled basis. And what we don't want to do is to hide information. and to pretend something hasn't happened, but to respond and communicate as quickly as possible, even when little information is known. So I would say in terms of preventing a negative impact on routine immunization, we need to be quick and responsive to any problems that might be occurring related to COVID-19 vaccine, and even be in the stage of planning for the possibilities of what could happen, so that we can respond immediately.
Wonderful. Thank you so much. I see a question from Wei Ling on where do you suggest for the community to obtain accurate and simple information about COVID-19 vaccines?
I think there are a couple of different sources on this. I know at WHO, we're trying to provide more and more resources. They're at different levels. I think some of the information we have might be a bit technical, but we're in the process of simplifying a lot of that, and also designing some of our materials that are really meant for distribution and sharing among other trusted sources of information like faith leaders, youth organizations, and even business sectors. So WHO's website would be a good start. I also hope that your National Ministry of Health has information that's maybe more tailored to the audiences that you're working with and your population. I think also probably UNICEF has some good information as well. And Kate and Michelle, I think you probably have some good resources as well. And Shoshana, I think on the Country Readiness Delivery website, we also have a number of even newer resources too.
Absolutely. And I'll add that we do also have the health worker training course that provides information about how health workers can be prepared for COVID-19 administration. And that training package does include a number of job aids that help to share easy information out, and those can be used by health workers and others for COVID-19 vaccination. So as Mindy said, there's a plethora of different ways to access this information. Certainly Country Readiness and Delivery webpage is a good starting point. And I see that that has been shared in the chat. We have a question from Oscar who asks, how should health workers respond if they're asked which of the vaccines is the best, or if the one they are giving is the best one? I'll turn to Kate and Michelle and Mindy to answer this question.
Thanks, Shoshana, and thanks for that question. That's an excellent question and a really difficult one to answer. From a UNICEF perspective, we remain what we call vaccine agnostic. That means we don't show preference for one vaccine over another, as long as it has had a pre-approval or from WHO or the governing body within a country who approves new vaccine introductions. So from that perspective, I think I would have a hard time responding other than to say you can explain your country's situation. Every country is a little bit different. So if it is a vaccine that is available that's been approved by either WHO or your country, you can explain that. So it's important for you to know that information. And then I wouldn't verbalize, personally, I wouldn't verbalize a preference, but just say that there's been a lot of effort to get vaccines out as quickly as possible, and that if there's a certain vaccine available and it has had approval, that you would recommend moving forward with that vaccine, because that is what's available. And there are going to be different vaccines available at different times in different countries. And so it is quite complicated, but to know your country's process for approval and understanding what has and has not been approved can help you to answer that question. Thank you. I think Shoshana might have a frozen camera. So I will go ahead and look at another question that we can cover. Oh, okay. Give me just a moment, everyone. So there's a question from Bamyan, who cannot get COVID-19 vaccine? So I think that question is about who is it contraindicated for, and who is it recommended for? So first I can say that if someone has had a dose of COVID-19 vaccine and had a severe reaction, they would be contraindicated for receiving another COVID-19 vaccine. For a very small number of people, you can have an allergic type, anaphylactic type reaction to that vaccine. They're gathering more information now on the COVID-19 vaccine and its safety for pregnant women and women who are breastfeeding. So those groups are not formally part of people who are recommended for it now, but they are gathering more safety details. And please, Melinda and Kate, if you have more information to share about that, please do. So, and then in terms of children have not been included in the vaccine trials. Now they have started to include some adolescent age groups. And so as more data is captured and there's more understanding of the safety for that age group, we'll see those age groups being added into the recommended populations. And this will all happen gradually over time as more and more of the trials are implemented in other populations and age groups. Thanks.
So Michelle, I see maybe I can pick up on another question that's being asked by Victor Ogaji. Sorry if I've mispronounced your name. Coming from a very religious country, how do we as healthcare workers address the community's misinformation, disinformation without contradicting their beliefs? I think you've touched on a really important point, and we've seen in past vaccine efforts that the religious communities can kind of go one way or another, and there can be a lot of confusion and misunderstanding, and then sort of confidence lost in vaccines. So we would encourage you now to really work with religious leaders for the different religions in your community and talk to them about their concerns. A lot of times it has something to do with the ingredients that are in the vaccine, and there's questions around what if that doesn't, the ingredients are not part of our belief system. So to just really get down to the nitty gritty and the questions that are occurring within the community and ensure to be able to answer those questions right away, and really pull in the religious leaders as part of the decision-making process and advocates for vaccine. And I think that will work really well. I know at WHO, and we've been doing this hand in hand with UNICEF and other partners, we're developing a suite of materials and very simplified materials for religious leaders to be able to use with their communities. And it even gets down to the nitty gritty of like, what is a vaccine? It's, simpler than what is the COVID-19 vaccine. It is what is a vaccine and how does that work with my body, and how does that keep us all safe? And I think this just bridges off of some other work that has been done around with religious leaders on generally how to practice their religion and keep it safe during times of COVID-19 too. So to use these same partners now, get together with them now and really work out these issues and get them to be advocates of vaccine now by hearing the issues in the community and addressing those.
Wonderful. I see there's a question about whether or not helplines are being established at the country level. For this, we advise that you look to your national, and for many of these questions about what age groups are being recommended for COVID-19 vaccination, what target groups are being recommended for COVID-19 vaccination, we ask you to look to your national guidance, as each country has the ability to choose how they want to move forward with COVID-19 vaccination. So look to your national policy recommendations. There is WHO global guidance, but this is being adapted at the national level. I see there's a number of questions about pregnancy and COVID-19 vaccination. There are a number of different resources available to help folks understand whether or not pregnant women should receive the vaccine. And we will also touch upon this in one of our future sessions.
Shoshana, there's a great question I just read about disinformation and how do you deal with it when it's a state authority, for example, a governor sharing a hoax. And this is a question from Akin Mayola Shobo. And it's causing hordes of community members to fight with health workers. I just wanted to share that because I think that's such an important question. And I actually believe preventing a situation like that can be the best way if it's possible. That means helping to train your spokespersons, including in your ministries of health and the leaders of your country and subnational level, helping to train them in understanding COVID-19 vaccine, help to train them in how to answer questions and to interact with the public. And that can help to reduce some of the sharing of disinformation at that level. And I'm sure there are other suggestions from the panelists.
Yeah, and just to bridge off of what Michelle has said too, I think what I've seen in my experience in working with countries and helping countries to prepare for emergencies, what we tend to do as WHO and other entities that come into this field is sort of work with the really health experts, those in the ministries of health and so on. And what we've and are now even seeing unveil itself now during COVID-19 is that we really need to be working more and more with the sort of ministries of emergency, and then also the the national governments, but the subnational governments as well. I mean, mayors of towns tend to have a lot of power when it comes to emergencies. And that's not typically the group that we as public health professionals tend to work with. But now you can see just in your example how important it would be to get with that individual and get them to be involved and an advocate for vaccines early on and to understand the threat of not having vaccines. So I think it's a bigger step and maybe not one that could be certainly addressed right now. But if you haven't and you're trying to reach out and really get a pretty solid vaccine communications campaign going around COVID-19, I would really encourage you to get with these sort of key individuals in sort of local governments, mayors, and so on. That I think it could really help this particular issue.
Wonderful. Thank you so much for these responses. I'm noting that we now have 1 minute left before our session will conclude. And I'd just like to bring up one question that I've seen come through in the chat a couple of times, which is if health workers are other priority groups for COVID-19 vaccine are being explained how important COVID-19 vaccine is. There is listening is conducted, but ultimately that health worker decides not to receive COVID-19 vaccination, that it can happen. And this vaccine is not a mandatory vaccination, right? So it's important to, at all times, respect the individual. So with that, I'll just turn back over to Kate, Michelle, and Mindy for any closing remarks, and then we will conclude today's session. And we'll start with Michelle.
Oh, sorry. Yeah, I was just going to say, I really appreciate everyone taking the time to listen to this session. I think it's such an important topic. And as healthcare workers and public health professionals, your opinion will really matter to people. So keep that in mind in terms of how you decide to communicate. There were a lot of questions about, well, what do you do if they say no, if they decline? And ultimately, that's okay, as long as that interaction feels positive and they leave that interaction thinking, oh, I think I can trust this person. I think I can trust this health system. then you've won that kind of situation, and hopefully that will bring more people in the future. So it's a big job you have, but continue being the advocates that you are, and I really appreciate you. Thanks.
Over to Kate, and then we'll close with Mindy.
Hi, everyone. I hope you can hear me. I've been having some connection issues, but just to reiterate what Michelle said, I agree. We appreciate you, and what I've really appreciated in this session is being able to see and learn from you all of the questions that you have. This helps us to also learn about the thinking and what's going on in your countries, and to be able to better support and respond to you. So thank you so much for your participation and being eyes and ears for us who might not be there. And we really appreciate all that you're doing and with the community members. So thank you. And I'll just pass off to Melinda.
Thanks, Kate. And yeah, thank you everybody for taking your really, really valuable time to be here with us today. Again, thanks, as you're hearing from everybody, for all of the hard work that you're doing and your dedication. You've always been a critical part of this response. And now with this last step of this communication with those trying to get a vaccination, you've become critical again. So really, thank you. Thank you so much for your attention today. And please do reach back out to us if you have any additional questions.
Wonderful. With that, we would like to close today's session. Please feel free to continue the conversation on TechNet and on Telegram. Those links have been shared. We look forward to your questions there. We will be sharing back answers to many of the questions after the call, so we can look forward to some of the questions we did not answer today, being able to answer those in the future. With that, we would like to say thank you so much and look forward to seeing you on our next session. Goodbye. And Kate, Michelle, Melinda, thank you so much for this fantastic session. As you can see in the chat, we've gotten really, really positive feedback. And we'll be able to share additional feedback once the feedback survey is concluded and those results are shared. But many, many thanks for this fantastic presentation of both.
Thanks, Shoshana. Thanks, everyone.
Thanks, Josh.
Thanks, everybody.
And thank you so much to the ECHO team. Everything went smooth in the end, so many, many thanks. I'll talk to you all later. Ciao.
Thank you so much. We are just ending the webinar.